Hello, my name is Dr. James Perkins. I'm a naturopath and a chiropractor. I'm the clinical director of Alternative Health Solutions in West Bloomfield, Michigan. And today I'd like to talk to you about sports chiropractic, and particularly if you're a physician watching this, or if you're a physical therapist, or if you're a trainer, I would like to pay attention, because this is very, very important that you understand the differences and understand what primary and secondary events in the body are all about. So we're going to just go through this very quickly. I'm going to describe the concept, and then I'm going to show you what the primaries are and the secondaries. This is wonderful in being able to evaluate a patient, evaluate an athlete, and I'm going to show a little bit of kinesiology, but the whole idea here is for you to understand primaries and secondaries. It's extremely important. It will streamline the way you look at anyone at any one time. Now, it's been years and years of research, mainly done for this particular concept on world-class athletes. Anywhere from Czechoslovakia to Greece to Russia, Canada has done a lot of studies on this. And so what we want to do is we want to teach you what's happening in the global community with concepts of athleticism and the athlete. If you're an athlete, you want to watch this film, you want somebody like myself or someone who understands these concepts, because it can really streamline the way that you boost your ability to reach the next level. And you'll see what I mean when I go through this. In the human body, there are primary areas of restriction and secondary areas of restriction. It's important that you know what these are so that you can figure out what's happening to the body, because after all, if you think about it, the whole body is connected together. Every part's connected. Every cell is connected. We are a seamless fabric of flesh. So when people have a problem with a knee or an elbow or a shoulder or a neck or a foot, what is happening there? What is really going on there? Where is the problem coming from? And what is it connected to? Well, it starts to boggle the mind, and pretty soon you end up in this sort of swamp of trying to figure this or that or this or that. So this is going to streamline what you're doing if you get the concept of primaries and secondaries. The secondary areas of the body are generally what the athlete or what the patient is going to complain about. They're going to have a sore knee. They're going to have a locked knee. They're going to have a trick knee. They're going to have a knee that's hypermobile. They're going to have a knee that just has a pinpoint ache to it. It's going to have some problem with it. They're going to have a shoulder that's locked up, or a shoulder that hurts them every time they do that backstroke. They hit the backstroke. As soon as it hits the water, bam, ouch. So we want to find out why that is. It's very important that you find out what's happening there in that shoulder or whatever, but let's go over these primaries and secondaries. The secondaries are generally the things that are going to have the complaint, the problem. They hurt. Not always, but they do. Generally, when you have a patient who has a problem in the secondary features, the first question you have to ask them is, was there injury there? If you can establish injury in the secondary area, you might be able to say, okay, that secondary area is now a primary, or has become a new primary. But if it hasn't been injured, it's probably significant that you look around at the primaries that are nearby, because that's probably some type of an overcompensation in the secondary features. So I'm going to give you a list right now of the primaries and the list of the secondaries. The primary areas of the human body are the foot and ankle, the pelvis, which includes all of the features of the pelvis, hip sockets, the pubic arch, sacroiliac joints, the coccyx bone, very important, often missed, and L5-S1 occasionally. Moving up the spine, the thoracic spine is sometimes primary, but generally mostly secondary. The cervical spine is primary. The cranial vault and the cranial bones are primary. And the cervical spine is primary. The viscera of the body, the guts, primary. Everything else is secondary. Shoulders are secondary. TMJs are secondary. The rib cage is secondary. Knees are secondary. And the lumbar spine is secondary. Now let me make this very clear. Over the years, the lumbar spine has been focused in on as a primary area. Oh, we see the bulge disc. Oh, we see all this vertebral misalignments, and we see nerves being pinched in the low back, and the vertebra of the lumbar spine, those motor units are involved in this person's sciatica and all that. Yeah, it's possible, sure. But oftentimes, the lumbar spine is really working hard to try to adapt to the pelvis. If you look at the pelvis first, before you look at the lumbar spine, and remember, ask the patient, ask the athlete, were you injured in your lumbar spine? Oh, yes, I was. Yes, I was sprinting for the ball. We collided. I heard a snap in my lumbar spine, and it was just like a hot poker going right in there. And okay, well, now we maybe have an injury in the lumbar spine. We're not sure. Are diagnostics at that time appropriate? Probably. X-rays, MRI, something, but always, even still, look at the pelvis. Now, you can look at the pelvis in many different ways. There's a lot of kinesiology testing. You know how to do this. I'm sure you've all been trained on how to do this. And if you're a patient, you want to find a doctor who has been trained in this. There's some simple things that you can do to figure out, is it a jammed hip socket? Is this hip socket slightly out of place? Has the pelvis tipped forward, or has it tipped back? Is there a problem with the coccyx bone? Is there a problem with the pubic arch? I find this pubic arch all the time, and the pubic arch and the sacroiliac joints work together as a team. You don't always find them together, but when you have a pubic arch that is misaligned or locked or popped up or involved in some way, you want to always look at the sacroiliac joints, and you oftentimes will find them together. Person comes in with a knee problem, and you find that, gee, that's interesting. You have a knee problem, but you've got good range of motion, and you test the range of motion on the knee. You might test the muscles. Hold your leg tight, please. Thank you. Hold here. Don't let me push down. Everything looks good. Say, gee, did you have pain doing that? Not really. It's not always when I do that. It's often just times when I'm running, and all of a sudden, okay, was there injury? First question, was there injury? No, I've never injured my knees. Well, now let's go to the foot. Let's test the foot. How do you test the foot? You know how to test it, or find a doctor that can. Come to my office. Call me. I'll check your foot. Ranges of motion of the foot. How it bends. Is there pain there? You can do this. You can also test the muscle of it. Don't let me push toward the wall. Push against my hand. Thank you. Try the other side. Muscle test it. The point is, primary, ankle, foot, primary, hip socket, pubic arch, coccyx bone, SI joints, primary, the viscera, the thoracic spine occasionally, particularly if it's been injured, cervical spine always, cranial vault always, cranial bone. So if you do craniosacral therapy, that's perfect. Just test it. Shoulders, rib cage, secondary. Lumbar spine, secondary, most of the time. Legs, knees, secondary, but that's where you're going to see the pain again. So I think this is a very important technique. I hope you got something out of this. Please call my number, 248-855-8707. If you're a practitioner and you'd like to work on this concept a little bit more, call me. We can get together. It's not a problem. If you're a patient and you're an athlete and you'd like to know more about this, please see my website, my-alternativehealth.com, and Google that and look at sports therapies, and you'll see this on there. And go over it again. So give me a call. If you're a patient, you need to be here. If you're an athlete and you're struggling with some things, if you're a stunt man, you're a stunt woman, you've got to be here. So call me now, please. I can help you. Thank you and have a great day.